A prevenção do cancro do colo do útero em Moçambique é importante pelo fato deste ser o cancro mais comum na mulher, responsável em 2018 por cerca de 4.300 novos casos e 3.400 mortes.
More than 3,000, almost 3,400 young women die every year, and these are women often in the prime of life, with families, with jobs, with careers. So it's a really important problem to address.
Our team at MD Anderson, along with our Brazilian colleagues, has been working here in Mozambique since 2014, focused primarily on cervical cancer screening and treatment. A lot of the work has been in increasing access to screening and developing new technologies to make the screening more efficient and at a lower cost.
Estamos a implementar aquilo que é o HPV como método de rastreio para melhorar aquilo que vai ser a incidência do cancro do colo do útero e diminuir assim também a mortalidade por este cancro.
We're very excited to have received this peer funding because it's really allowing us to scale up our work. So we're going from a small pilot project to really a large study that will screen over 14,000 women in Mozambique and now integrate that with voluntary family planning services.
Well, we know how important it is that we make sure that cervical cancer prevention control is integrated into other health care services and is sustainable going forward. So we're excited about these two programs because they're looking to see how we can integrate cervical cancer screening as part of voluntary family planning.
As part of that, we will also further develop the technologies that have been developed by Rice University, again, to improve the screening and diagnosis of cervical cancer.
Temos já o privilégio de fazer esse teste, podemos detectar a infecção e depois de teste das pacientes, se for positivo ou não, observamos as pacientes, a ver se tem alguma lesão já pré-cancerígena e tratamos.
I feel like what USAID has to contribute to that is really the experience that we've had for over 30 years in working at the community level and at the facility level in maternal and child health programs and in family planning programs.
If we're successful, we will have developed a refined, impactful sexual reproductive health model, and that will be a win-win for the donor community, for the national government, for the global cervical cancer elimination agenda, and most importantly for the women we serve.
Seria importante para nós envolver este rastreio, esse tipo de teste, em todos os cuidados primários, como planeamento familiar e ao mesmo é um tipo de prevenção. Então, ao mesmo tempo que vêm as mulheres para fazer o planeamento familiar, a gente pode também fazer o screening e isto vai ser muito útil para reduzir a incidência do cancro do colo do útero.